everybody, Dr. Zach here at the Spine and Health Clinic of Chiropractic. So today we have Alexa here, and she has been going on some knee injuries. I've been dealing with some things that we're trying to fix here. So I like to tape knees. So for those of you who don't know, you've probably seen this on athletes before, just like her. And what this does is it basically kind of helps the brain-body connection. It's proprioception, or kind of the sensation that you feel when you touch your skin. It kind of goes back to your brain. And what that does is it allows and helps with inflammation to some degree, and then it also kind of just helps overall with the body's biomechanics and how it functions. I'm not going to go into too much detail because I don't really know if I completely believe it all or not, but the stuff is magic, and my patients love it, and they do get some pretty good results from it. So today what we're going to be doing is I'm going to show you a little bit how to tape a knee, and if you guys want to, you can order this stuff online and do it yourself if you'd like to, but otherwise I just kind of want to show you a little bit of video here. So Alexa has some pain on the outside of the knee here, and same thing on the inside here. In one of the videos before, we adjusted the knee. Obviously, that's going to be first and foremost. The thing with the knee that you guys have to keep into consideration is the hip is going to be a mobile joint that moves in all directions. The ankle, same thing, it's a mobile joint. The knee is a stability joint. What does that mean? It means that it only really moves in one plane, so it has an impact, or is affected by a lot of the structures that are attached to it. So when you have knee pain, what you really want to do is make sure that the muscles and the joints above and below are checked out and moving properly. You want to make sure the tension in the muscles are also going to be more unison, because what's going to happen is if you have an IT band or something of this nature on the outside pulling too hard over a period of time, you're going to cause that knee to shift to one direction, and that's going to cause an improper wear pattern. And then it's just a matter of time before you start to elicit some pains there. So the knee is a complex joint in the sense of there's a lot of things attached to it that are very mobile, and there's a lot of muscles that are attached to it as well. And when you have tight glutes, or you have an IT band or a TFL, or any muscles that attach to the knee that are spastic, that's going to cause that improper wear pattern, along with any immobilities in the joint and the hip. So with the knee, there's a lot of things to check, and that's what we did. We adjusted the ankle along with the hip, and now we're going to the knee. The knee is a little bit more discretion, I guess you could say, with the adjustment, just because there's not too much to do to it, so that's why we like to tape it here. So what we're going to do here is we're going to start with the knee all the way back, all the way here. Good. And essentially what we're trying to do here, and the way that this tape works, is you want to put it on stretch. What does that mean? It means you just put a little bit of a stretch in there and you put it over the skin. And the significance of it, you always want to have the joint flexed. What does that mean? It means the knee's back. And I'll show you why here in a second. So, what we get here. One thing that I like to do is a little bit of rubbing alcohol. I guess this is just going to be hand sanitizer. There's alcohol in it. And you take and wipe off the oil from the skin. I found to make this last, or the tape last a lot longer when you do this, which is obviously more beneficial. The longer the tape stays on, the longer lasting results there. So let's go there. And just general rule of thumb, you have the patella, or you have the kneecap, or you have this floating bone right in the middle of your knee. What you want to do is you want to go around that with the flexed position. You start by just putting the tape on, and then you apply a little bit of pressure, you're pulling down. That's the stretch. And then you just outline this kneecap here and firmly push on the tape here. This one's going to be a little different. I'm going to go up here. This. And the third piece is going to come right back around, outlining that kneecap again here. So, now, when the knee's flexed, the magic of the tape comes when you extend the knee. You probably can't see too much from there, but you want the knee and the skin to wrinkle up. That is going to be the most significant thing of this tape. So when you go to a neutral position and the elbow or the wrist or the knee or whatever you put the tape on is neutral or just kind of in the resting position, there's going to be wrinkles in the skin, and that's going to basically kind of make the tape work a little bit better for you. So here's a little bit of how you tape the knee and some things that you can do for the knee. Obviously, tape's going to be a good thing. Otherwise, make sure that the muscles around the knee aren't tense. So you can see massage therapists for that or whatever you may be. Foam rollers work great too. So thank you all for joining us.